fun, and the goal is for us to keep on going for the remainder of the semester. So we welcome you uh, after a very, very challenging January. Very challenging January. And that's all I'm going to say. We all went through it. We are surviving. Like I told you, we need to keep on going. We need to keep on going, and hopefully things will get better and better and better. So you are here today for a treat, a very special time, and I hope you take notes, not only mental notes, but real notes as you write down and as you're going to be exposed to several interesting and important concepts and ideas. I think you really, really will enjoy that. Dr. Roberts, before I turn to Dr. Roberts, I wonder if you have any announcements, because I'm going to ask Dr. Roberts to introduce our guest speaker. Any announcement? No? All right, I do have one, and you know what it is. This thing right here, if you can silence. And like I said, let's move from FOMO, fear of missing out, to JOMO, joy of missing out. Right now, we are going to enjoy this time together. And we will only be able to do that if you put that thing on the side. The whole world will keep going, while we're having some fun and good time together here. So, Dr. Roberts, please come and introduce our guests.
Thank you, Dr. Cunha, and thank you to each one who has come today. You're in for a very special treat. Dr. Alice Cash lives in Louisville. She and I were classmates in the doctoral program at Southern Baptist Theological Seminary a few years ago. I won't say how many, but a few years ago. She went on and did her completed more doctoral study at the University of Kentucky. She's been involved in finding ways to apply medicine, music to medicine, to patients of different needs, which she's going to describe to you, and has been active in that for quite a few years. Her daughter Julia is with her today and brought along her violin. They're going to demonstrate some examples as well as describe. Julie and her family has just moved to Louisville from Boston. That's Boston, Massachusetts, not Kentucky, and is now playing with the Louisville Orchestra and then still teaching her students back in Boston. So you can do that online, as you well know, and many of you have experienced as well. So there'll be, following the program, there'll be some time for a few questions and answers perhaps, as well as they have brought along some CDs, which we have out in the back, $5. There's two different kinds. And then there's also a book describing some of what they're going to talk about, which is $10. So you're welcome to consider purchasing some of those if you'd like. Now, if you will, please join me in welcoming Dr. Cash to the concert stage.
Thank you, Wesley. I'm so happy to be here today. I've been looking forward to this for some time now, and it's especially a joy to have my daughter with me. This is the first time we've done this, and we're really looking forward to it. The time was July 15th, 1985, and in a small town in eastern Tennessee, a family of three, Mom, Dad, and 5-year-old Billy, learned that they were expecting a new family member around Christmas time. Everyone was so excited, and a new family ritual was begun. Every night after dinner and after getting Billy ready for bed, the three of them would sing songs for the baby that was growing in Mommy's tummy. Billy's favorite was "You Are My Sunshine," and he always sang it with great care and emotion, knowing that it would surely become a favorite of his soon-to-be-born baby sister. They sang many other songs too, but You Are My Sunshine was Billy's all-time favorite. The new baby was expected around Christmas, but very unexpectedly, the mom went into labor in early November, almost 6 weeks too early. The baby was not ready to be born, but despite everything, the baby was coming. Billy was so excited, and all he could think of was to ask his parents, "When can I sing to her? When can I sing to her?" Of course, Mom and Dad were now at the hospital, and Billy was with the neighbors. He had no concept that the baby coming so early was really not a good thing. Mom and Dad were staying at the hospital now almost around the clock, and at this point, hovering over their 1.5-pound infant, lying so helplessly in the NICU, attached to so many tubes and machines. Still, Billy kept asking, "When can I sing to my baby sister?" After almost a week, the baby was not doing well, and the doctors and nurses told the parents that they might need to start planning for a funeral. They were devastated, of course, but remembered how much Billy wanted to see and sing for his newborn sister. Even though children were not allowed in the NICU, they decided to take Billy down to the hospital and let him sing for his sister. They would find a way to get him in. They arrived at the hospital and found some scrubs and a mask, although way too large. They put them on him and started through the door with what looked like an overgrown laundry basket. The head nurse immediately shouted, "You can't bring a child in here." But they were determined that he would sing for his sister, and they explained the situation to her. She said, "Okay, but no more than 5 minutes." Quietly, they tiptoed over to the tiny baby lying in her isolette, hooked up to so many different machines. They said, "Okay, Billy, start singing your song to her." And gently but sincerely, he began to sing. "You are my sunshine, my only sunshine. You make me happy when skies are gray. You'll never know, dear, how much I love you. Please don't take my sunshine away." As he sang, the miracle began to happen. The baby turned her tiny head toward her brother and started breathing more deeply and more steadily. The blood pressure machine started leveling out, and the baby seemed to know that this familiar sound was the sound of her little brother, who was so anxious to meet her and bring her home. Before they knew it, the nurses were gathered around and were saying, "Keep singing, Billy, keep singing." After that experience, the little baby girl began to thrive, and a few days later, the whole family came home together. Was it the music? Was it the powerful love the baby felt from this brother who had been singing the song to her for 4 or 5 months? I believe it was all of these things delivered through God's amazing gift to us of music. This is a true story and appeared in Woman's Day magazine in 1985. Never forget how powerful music and a simple song can be. So with that, I want you to know that this was my introduction sort of to the idea that music can be so powerful. By 1985, I had 3 children myself, and I sang to them a lot. Unfortunately, not before they were born. But what I've learned is, let me advance the slides here, by the 2nd month of pregnancy, the 2nd trimester, the baby's ear is beginning to be functional. And the baby can actually hear the mother's heartbeat, the mother's blood circulation, and things like that. And that becomes their sonic environment, which is very comforting to them and makes them know they're where they need to be, where they're supposed to be. By the third trimester, they can hear lots of sounds outside of the mother. They can hear singing, they can hear talking, they can hear music. So it's very important if you have any friends or family members that are pregnant right now, that they keep their sonic environment very healthy. And if possible, sing the same songs to the unborn baby. And once the baby is born, whether prematurely or not, it will be a huge comfort and almost an immediate way to calm the baby and let them feel safe and secure in their environment. The other introduction to the power of music with medicine came to me in 1991. I was hired by the University of Louisville School of Medicine to be their coordinator of music and medicine. They had just gotten a big $1 million grant from the Fetzer Foundation and were looking into alternative healing modalities, and music was one of them. So my boss at that time was a 75-year-old psychiatrist, and he said, Alice, so many people are being diagnosed with Alzheimer's these days, and we know that it's almost an epidemic. And there are many anecdotal accounts of patients who do well, they calm down when they hear familiar music. But I want you to go and do a study. So he gave me a whole team of research psychologists and statisticians and things. And I had one assistant who was a music therapist. And we went to a nursing home in Louisville that had what at that time was a state-of-the-art Alzheimer's units. Did any of y'all have any experience with Alzheimer's patients or helping? Yes, okay. Grandparents, even parents. So one of the things that happens with many Alzheimer's patients is that they want to pace. And all day long they are pacing. So this nursing home created a circular hallway system so that they could pace safely and feel like they were doing what they needed to do. And my understanding was that many of these patients feel like they're looking for their childhood home, and they're looking for their parents, and they are very disoriented. They have lost track of where they are, what year it might be, anything like that. So their family members had to give us the permission to do this study. And so what we did was choose 30 minutes of familiar music for each patient that corresponded to their courting years. We found out that it's the music of the courting years that seems to be remembered to the very end. So basically, we looked at their teen years through mid-20s anyway, and considered those to be their courting years. And I dug through boxes and boxes of old sheet music. I had many old hymnals because the Alzheimer's patients love the old hymns that they sang growing up and feel very comforted by that. And so for each session, we would start out asking a set of questions. And those of you who are nurses or from the nursing school are probably familiar with the Folstein Mini Mental Status Exam. So we would ask them things like, what year were you born? Where were you born? What was your mother's maiden name? Just basic things like that. And many of them had no clue at all. And then we would give them 3 words to remember. And they were things like watch, pen, and saucer or something, and say, now, try to keep those words in your head. Then we would start the music. And as soon as we started the music, my assistant would make a notation, whether or not they sang along, nodded their head, smiled, tapped their toe, what their response was. And we would do that for about 30 minutes and talk to them between each piece. Do you remember when you first heard Tiptoe Through the Tulips? Where did you hear that? Was it on the radio? Did somebody sing that to you? And a lot of times people who normally did not speak, they were nonverbal, they would answer a question and they would actually volunteer some information. So we would do this twice a week for 30 minutes, and then at the end of the 30-minute period, we would ask them those same questions again. Can you tell us where you were born? Do you remember what your mom's maiden name was? Birthday? And 9 out of 10 times, people were able to answer at least some of those questions that prior to the music they couldn't. So what we learned was, with Alzheimer's patients, music is a wonderful temporary intervention. It's not going to cure Alzheimer's. It's not going to stop the progression. But it's a way of giving people one time during the day when they experience joy again, when they experience something familiar. Because with Alzheimer's, the world suddenly becomes unfamiliar and foreign. And to be able to give them something, oh, I remember singing Amazing Grace. I remember singing Jesus Loves Me. And it gives them a happy moment during the day. And usually, not only are they more relaxed, but they eat better at the next meal. And when people come down with Alzheimer's, all 5 senses just are greatly dull. They don't taste anymore, therefore they don't want to eat. They lose lots of weight. But after having the music therapy session, they have a little bit of an appetite. They sleep better that night. And again, you've given them some happiness that they did not have before. So those are 2 of the big areas that I've really worked with initially: the preemies and newborns, and then Alzheimer's patients. And I'll talk with you more about my most recent endeavor, which is music with surgery. Anybody here ever had surgery? Okay. Did you enjoy it? No. Nobody has surgery for the fun of it, but it's because you've gotten to a point where you need that in order to have a good quality of life going forward, if possible. So I thought you all might be interested in hearing a little bit about how music affects the mind, body, and spirit. And to understand, people used to talk about the mind and the body and the spirit. Now we know it's all one. The mind is in the whole body, and the body reflects all that's going on in the mind and the spirit. And music can be a very powerful way of adding healing to that. So first of all, how does music affect the mind? 2 primary ways: associations that we have with any given piece of music, and then the memories that we have associated with that music. And they're very similar. I think of associations as being broader and the memories being more specific. Let me fix this so I can see exactly what you're seeing. Okay, so when you were a little child, did you have anybody that sang to you at bedtime? Raise your hand if you had someone who sang to you or with you at bedtime. Do you remember any of those songs? Can somebody tell me a song that they remember from childhood? Brahms' Lullaby. That's a good one. Okay. Did anybody ever hear a song called Kentucky Babe? Do 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 do. Sleep, Kentucky Babe. I made a CD of lullabies, and that's one of the ones I put on there. I didn't bring that with me today, unfortunately, but lullabies are for grown-ups too. And so the songs that we learned as little children, whether it was bedtime, whether it was Bible school, Sunday school, school, all of those songs bring back floods of memories. My father used to sing with my sister and me at bedtime, and he would sing some of the songs that he learned in the Army in World War II, songs that they would sing while they were marching through the woods in Belgium on their way to the Battle of the Bulge. And it was songs like, "Do your ears hang low? Do they wobble to and fro?" You know that song? That's a song that started in the Army, supposedly. But those songs, if I'm having a hard time or a difficult day, I can just think back to some of that music from my childhood, and it just makes the bad vanish temporarily. Again, none of these things are forever, but the power of the in the moment help that it brings is pretty amazing, I think. And how about songs that you heard in middle school and high school? Anybody remember songs that you danced to at school dances? I mean, I vividly remember, of course, I'm way older than you all, but when I was in middle school, Elvis was popular, and he wrote a song called Can't Help Falling in Love with You, and I remember dancing to that. And so anyway, the associations we have with our own childhood and courting years music is very powerful. Okay, so how does music affect the body? One of the things that I have really learned a lot about is a phenomenon called rhythmic entrainment. Now, we have rhythms going on in our body. Anybody know what some of the primary rhythms in our bodies might be? Heartbeat and respiration, okay? And somebody said walking. I mean, when we walk, hopefully we do walk in a rhythmic way, because if you don't, you're going to fall down or you may have some gait issue. But what is the first thing the doctor does? When he walks into an examining room, he takes his stethoscope and he listens to your heart and he listens to your breathing. And if they are not steady and clear and strong, that's a sign that you might be unwell, and we might need to examine that a little more. But there's something in music that engages these rhythms. So if you hear, clap with me while I do this. Okay, how are you able to do that? Well, you've got a good ear, you've got a good brain, but there's a thing called rhythmic entrainment that makes your body want to synchronize with the pulse of something nearby. And without even realizing it, you start nodding your head to a piece of music, or you start tapping your toe. You don't even think about it, you're just doing it. And that's what we noticed with the Alzheimer's patients, for example. I mean, they couldn't tell you where they were or what year it was or anything like that, but they could tap their toe, they could nod their head, and a lot of times they could sing the words. The words would just come flooding back. So this is the power of entrainment, and specifically rhythmic entrainment is something that my music and surgery idea is built on. Okay, so how does music affect the spirit? When you're feeling down and you're feeling glum and like things are just not working out the way you want it, music can lift you up in a way that very few other things, non-chemical, can. Music can do a lot of the things that people take substances for, either to numb the pain or to energize, to make you feel lifted up and like everything's okay. The problem is when a substance wears off, you're back to the same place where you started. But with music, you can keep on playing that or listening to something for as long as you want. And it has, think of the music that we sing in church. I mean, the power of congregational singing lifts the spirit of everyone there and makes you feel committed to doing what the words of the hymn says, or the words of that song. You want to believe, you want to put your trust in God, you want to forgive and be happy. And music can deliver that in a way that few other things can. So I wanted to talk to you, I tell you, let's take this opportunity now to listen to a little bit of music. My daughter, Julie, is going to play some excerpts of pieces. One of the things I wanted to point out, let me go back to the previous slide. There's a difference between how music that is familiar affects you. When you hear something you know, there's sort of a, ah, it's, reassuring, it's comforting. People like to hear things they know. And I know when I go to concerts, I always hope there'll be at least a couple of things I know and not all brand new music. But there can also be music you've never heard before that you really, really enjoy because it's in a style that you're familiar with. So we're going to sing, we're not going to sing, we're going to play some things for you today and see how they affect you. And I may ask you to talk just a little bit about what you feel when you hear this. And I'm not going to tell you what it is because I want to see if anybody already knows these. I'm thinking this will be an unfamiliar one. Okay, I'll start there as an intro. Did anybody happen to know that song? Have you ever heard it before? I don't believe I see any positive nodders. Okay. That's a song from a very different church than what we probably all go to. This is a song from the Mormon hymnal, and it's called As the Dew from Heaven Distilling. And even though I certainly don't agree with Mormons, I think that is a beautiful, beautiful melody. And I've come to listen to a lot of that kind of music during the pandemic, very reassuring. So how did you feel while you were hearing that? What sort of imagery came to mind? Okay, a sense of floating and lightness. All right. Anybody have any particular images of fields or flowers? I'm sorry? What was that? Relaxing, yes. Okay. And that's because it has the slow tempo that makes your body want to slow down the breathing, slow the heart rate, and just let go of stress and tension. Okay, we're going to play now one that's very different. Probably unfamiliar also, but not sure. Mm-hmm. Okay. Yeah, just go straight through. Anybody know what that is? Did anybody recognize that? It's a piece called Salut Demore, and it's by the famous British composer Edward Elgar, the man that wrote Pomp and Circumstances. I think that's a beautiful little sort of encore piece. Okay, so you've heard two things that you did not know. Now we're going to play something that I think you'll find familiar. Or does anybody want to talk about what they saw during that or felt or noticed?
I was in a rowboat or a gondola.
Oh, okay, wonderful. Awesome. How was the weather? Excellent, excellent. I mean, music can transport you like that. So that's why it's always existed. All right. And there are no repeats in this. We won't do any repeats. Okay. Yeah, the other one was written differently. Anybody heard that one before? Yes, I thought so. Okay, and did it affect you? Did your spirit or body feel different when you heard something that was familiar? It's kind of hard to put into words, I know, but when you hear something familiar, you just kind of go, oh, I know that, and you can sort of relax at a different level. Okay, so I wanted to talk to you all today about the difference between music therapy and music medicine, because people do tend to use those terms interchangeably, and for the most part, among the general public, nobody is going to care or probably know the difference. However, if you're a music therapist, it makes a big difference. And so one of the things I try to tell people is that music medicine is used more in a wellness setting, whereas music therapy is used more in a healing or illness or remedial setting. So, for example, music therapists work a lot with children who have cerebral palsy, perhaps, children who had birth defects, spina bifida. They work a lot with adults who've had strokes. They work a lot with adults who have Parkinson's disease. And it's a process that's very much one-on-one. The music therapist creates a relationship, a therapeutic relationship with the patient. And the music therapist comes up with therapeutic goals that use music to accomplish goals that previously other things they would have other ways of achieving that, but they find a way to use it with music. For example, a lot of things in psychotherapy issues like self-esteem, people work a lot on self-esteem with music. They work on chemical dependency. I used to work in the chemical dependency unit at Baptist East Hospital in Louisville, And one of the things we did with the patients was to rewrite the lyrics to a lot of songs, because you probably know a lot of country songs and popular songs talk about drinking and, let's get blitzed or whatever and have a good time. And we are trying to teach them that there are a lot of ways to have fun that do not involve drugs or alcohol. So rewriting the words, people can get very clever and very funny and right on with these lyrics. But anyway, that's the kind of thing that a music therapist does. Music medicine is something that any of us could do. And definitely doctors can implement music medicine interventions. So music medicine is apt to rely on recorded music, let's say. So when I had my idea to create headphones that were preloaded with soothing, steady, serene music, my idea was that when somebody arrives at the hospital the morning of surgery, and let's say they're going to have a knee replacement or a hip replacement, and they have a lot of anxiety, very high anxiety. The big fear with surgery is, will I wake up? Will I be back after this procedure? So my idea was, what if we could give them some headphones that had calm, soothing music on them, and once they're in their gown and have the IV inserted, then we just give them these headphones and they can just calm down and chill out through rhythmic entrainment to this specific music. So one of the hospitals in Louisville decided that they would do a study using my headphones. And they wanted to do it it was the Veterans Hospital. So all the patients were men between 18 and 75 years of age, I think, that were having major abdominal surgery. And what they found was that the patients who listened to the music through headphones before the surgery took significantly less Valium and Xanax and things like that, benzodiazepines. And the patients who wore the headphones through surgery used up to 50% less anesthesia. And that's huge, because anesthesia is one of the things you have to recover from. When you have surgery, you have to recover from the disease that caused you to need surgery. You have to recover from the actual cutting into your body of the surgery. And then you have to recover from the anesthesia. So when a person has general anesthesia, all of the bodily systems during that period just shut down. And it takes a while after the anesthesia to get all of that cranked up again and get the body moving in the way it's supposed to. But then people who continued listening to the music on the headphones through the recovery room used up to 50% less pain medication. And you probably know pain medication is one of the very addictive parts of medicine. And people get to where they like that feeling of floating. And several of you all were floating today with the music. Music does it the same thing, and without any risk of addiction. So anyway, I had this idea in 2005 at a conference I went to, and several people said, Alice, that is such a good idea, you better get a patent on that. So spent a few $1,000s, and I was able to find a lawyer who got the patent approved, and I started selling these headphones in 2009. And they are now in veterans hospitals, in Cleveland Clinic, in Mayo Clinic. I just sold some to Cedars-Sinai Hospital in LA last week. And I really am hoping that one day they will be in hospitals all over the world. But anyway, that is music medicine, which can be accomplished by prescribing the right music for the right situation. Now, it can also be accomplished by good amateur musicians who are willing to go into a hospital and play for patients. Sometimes, I know when I visited Julie in Boston, her husband was a doctor in the hospital there, and there's a lady that would play the harp in one of the waiting rooms, and people whose family members were having surgery or, getting diagnosed with different things, they would sit there and this lady would just play the most beautiful heavenly harp music. But yeah, all of that is music medicine. You cannot get a degree in music medicine. You can get a degree in music therapy. As a matter of fact, you can get one at the University of Louisville School of Music now. As of 2000, we have a music therapy program there. But I have learned music medicine primarily through going around the country to different specialists and studying with them and just sort of trial and error. And I did go back to school after I got my PhD in musicology. I went back to school and got a master's in clinical social work so that I can do a lot of the counseling kind of things that medical patients need. So that's been very, very helpful. Okay, so what I wanted to offer you all today, if you want to understand more about all of this, there are a lot of free things, and I don't know that you've got pencil and paper. You can write some things down or take a picture of the screen with your camera. That's what most people end up doing. But I did not bring the preloaded headphones today because I just keep in stock the number that people have ordered. But you can get those on my website, and I'll show you the website in just a minute. I did bring my book. I just wrote a book called Having Surgery, Using Music to Reduce Anxiety and Pain Perception. And those are somewhere out there. Wesley has them. And in the lobby, okay. And so the book is $10, and then I have 2 CDs that are $5 a piece. One is the music for memory care, and basically it's the music that I played in our Alzheimer's study, Tiptoe Through the Tulips and Ain't She Sweet and In My Mary Oldsmobile, things like that. And then the other CD is a sampler, some lullabies, some music for Alzheimer's patients, some toning and chanting and things like that. So I hope you'll take advantage of those after we leave here. The free things, there is the website. This is what the headphones look like. This is me right before I had cataract surgery. So if you see a little mark on my forehead, that's so the doctor knew that she was going to start with the right eye and not operate on the wrong eye. And the headphones are in the back, over the ear from behind, and you just flip a switch and this beautiful music starts playing, and you don't have to have Valium or anything like that usually. Okay, and then I created 5 playlists. 3 are specifically for surgery: classical piano, jazz, and new age. And these were created specifically for my company. And then I have 1 playlist of lullabies and 1 of the memory care music, which is the same as the CD out there. These are downloadable from either the Apple App Store for $9.99 or the Google Play Store for $9.99. There's the book. You can get the book in the lobby, or you can go to Amazon and they'll mail it to you, or you can get the Kindle version if you'd like, the ebook. And it has lots of information other than just specifically about music with surgery. It has a lot of the information I've given you all today, a general introduction to what music medicine is all about and how it affects the mind, body, and spirit. And then you definitely want to take a picture of this screen. This is how to connect with me online. I have 2 main websites, surgicalserenitysolutions.com and then also Healing Music Enterprises, which is my original website. And you can download a free report, one called How to Talk to Your Doctor About Using Music During Surgery. I just had an email yesterday from a man in Nevada, and he said, I'm getting ready to have surgery in Las Vegas, and they don't allow headphones in the hospital. How can I talk them into it? So I said, well, I just happen to have written a report giving all of the research that once doctors realize this is well documented. This is not just some kind of a crazy idea. This is a well-documented phenomenon that people have been using actually for decades. And so sign up for that free report on how to talk to your doctor. And then there's another one called Boost. It says surgicalserenitysolutions.com/boost. That is, again, about how music affects the mind, body, spirit, and how music energizes your body, and cites lots of research studies and academic articles that people like to see. So I guess that's the end. Let's see if anybody has any questions. And if y'all would like to raise the lights in the auditorium so I could see people, that would be great. Anybody have any questions? Okay.
Hi.
Hi.
My name's Taylor Brown. I'm a soon-to-be senior theory composition major.
Wonderful.
And I have been thought about in the past going into music therapy. And I've heard that the University of Louisville had a program. Do they have graduate or master's programs? Is that what that is a master's program?
The program at University of Louisville is a bachelor's level program. And I think about the only requirement is you need to be able to play an instrument fairly well or sing. And even then, most music therapists seem to carry guitars with them. So, but there's some that play flute or piano or harp, things like that. Then the University of Kentucky has a master's program in music therapy. And numerous schools have doctoral programs in music therapy. You can go to Florida State, for example, and get a doctorate in music therapy. But the background for many people who get masters in music therapy seem to have a bachelor's in music education too. So, does that answer your questions?
Yes, thank you.
Okay. Let's have another one. Did I fully answer all of the things? Don't be shy. That's a good question. I personally don't, but that is an area where music therapists do a lot of work, and I did want to mention that, so thank you for asking that. The question was, do I have experience working with patients who are dying? I don't personally, but I certainly know lots of people who do this work, and there is a hospital in Montana called St. Patrick's Hospital in Missoula, Montana, and a wonderful music therapist there started a program called the Chalice of Repose. And it's based on a medieval concept. The idea that when babies are born, they are being transitioned from world before this world to this world. It's a transition. And when people die, they are also making a transition to the next life. So the music therapists find out what music the individual really loved during their life. And they have these small little harps called troubadour harps that they take from room to room and play with the person. They actually sometimes get in the bed and play this harp and sing hymns and chants and songs like that. And I remember when I first heard about it, they said that they will even make a cassette. Of course, we don't have cassettes anymore, but they'll make a recording. They'll make an MP3 file of the songs that your family member particularly wanted to hear. And then after they pass on, they will give you that, and it's a way of going through your grief process using the music that they loved and gave them comfort. So I think that's a great idea. And I know, again, Baptist Hospital East in Louisville, they had chaplains that would go to the unit where people were dying, the hospice unit, and play hymns on the guitar. And even when people have their eyes closed, even when you think they're not listening, they are. And I know for me, I've thought many times, what would I want to hear if I thought my time was near? And one of the old hymns that I love is Softly and Tenderly. And I love to hear that. I just sing it in my own mind. And supposedly, singing something in your head can be almost as powerful as playing it on an instrument or singing it aloud. Just thinking about it in your mind can bring comfort and peace and security like nothing else. Thanks for that question. Any other questions about another population? I think we're coming to a time in history where people realize hospitals really are for sick people. And if you're not sick, like let's say you need a knee replacement or a hip replacement, why do you need to go to a hospital where you could pick up COVID or staph infections or all kind of things? So we're going back to the idea of having birth centers, because women who are giving birth, they're not sick. Don't put them in a big hospital. We have ambulatory surgery centers that just do joint replacements and cataract surgery, things like that. People who need those procedures are not sick, and they don't need to be mixed in with the ill population. So, it seems so many things when we think of it, it seems like common sense, and yet we did it the other way around for many years. Oh, no, you have to be in a hospital to have a baby. Unless problems are anticipated, the birthing centers do a great job, and mother and baby and father are home later that day. Yes. Block. Yes. Fantastic. Wow. Yes, yes. For those that didn't hear the lady, people who were watching online or streaming, she was saying that she had an MRI last week, was it? Or yeah, a couple of months ago. And it was a 2-hour long MRI, which is, they must have done head to toe. But they gave her headphones, and she was so relaxed during this procedure that, historically, sounds like jackhammers and just, rattles every bone in your body, which is sort of part of what they're trying to do to get that image. But she was so relaxed that she actually fell asleep during the 2-hour MRI. And she was thinking, wouldn't that be nice to have at the dentist's office or at the joint replacement surgery, things like that. So there is more and more online about this, but that's exactly why I invented my headphones. And just last week, a lady dentist in California ordered 12 headphones, and I have them for children as well that have kitty cat ears and the lullaby playlist on it. So people are beginning to wake up to the value of this and how important it is. I guess that's all.
We've run out of time, Dr. Cash. Yes, thank you very much for coming. We appreciate it. And Julie, bring me some violin music.
Thank you.